Hi, my name is Greg Felt. I'm Director of Public Health in Sheffield. This is a situation report of Monday the 8th of February. Firstly, epidemiology. What we've seen for the last couple of weeks now is a pretty steady decline in the 7-day rate, currently in the order of 210 per 100,000. I expect it will be below 200 per 100,000 by the middle of the week, and what remains to be seen is where it will settle. We all hope it will get down to the rates that we saw last summer, 20 per 100,000. It may take a while to get there, and the impact of the new variant, the B117 variant or the Kent variant, will obviously put an upward pressure on transmission. So rates are coming down well. It remains to be seen how low they will go and how long they will stay low for. We can change that collectively. Importantly, rates in the elderly are coming down pretty well, and the elderly are the group that we obviously worry most about because they're the most likely to be seriously ill. Most of the transmission remains in working age people. They're out and about more, they're at work, and they're mixing more. R is almost certainly below 1. Last estimate I saw was between 0.8 and 1. The further below 1 it becomes, the more quickly the virus and the epidemic shrinks. But we've seen it's close to 1. Baseline rate of infection is high, can flip quickly, and we've seen that on a number of occasions through the course of the pandemic. And even at the current level of infection, that is still causing harm to people. Hospitals are still pretty busy. So on hospitals, still about 20% of the bed base has a patient, 20% of beds have a patient with COVID in. There are still a significant number of people in critical care. Hospitals have probably seen the peak, but the decline is slow, and hospitals are busy and managing the whole of the hospital care for the whole of the city. When 1 in 5 of your beds is used by someone with COVID, it's really very difficult, and it's so the room for manoeuvre remains pretty small actually. Just of note, the cohort in critical care are younger than you might imagine. So there's a significant number of people 45 to 65 in critical care. So anyone who thinks this is only an illness of the very elderly is mistaken. It's a disease that can affect younger people as well, and you affect younger people really quite seriously. So the situation in hospitals is getting better. I think that will get better over a long period of time. We all know that both primary care, general practice, but also social care are also acutely busy, and they will remain busy for a great length of time to come. Our room for manoeuvre is slim to zero. Therefore, we cannot afford unmitigated transmission in the population. The 70% of cases this week are the B117 or the Kent variants, more transmissible. The jury's out as to whether or not it's more lethal. There is some data that it might be. It's not strong data, but again, all the more reason for caution. The control measures are just the same. Our issue and our problem is that because it's more transmissible, our level of vigilance becomes even more important. There are 2 other significant variants of concern. One is the South Africa variant, which has been in the press over the weekend, and the second one is a strain from Manaus in Brazil. To our knowledge, they're not in Sheffield at the moment. That may not last forever, but they're not in Sheffield at the moment. And the key issue is the issue of immune escape. So if I've been infected first time around with the original wild type virus, there's some data that indicates that the antibodies I have may not protect me from the South Africa or the Manaus variant, or may not protect me fully. Obviously, has been seen in the media, that has implications in terms of vaccine effectiveness as well, which is obviously a worry. Forward look, when will we see easing? I don't know, in short. Spring, when in spring is a guess. My sense is that there will be a very gradual and easing of restrictions, but there will be some restrictions on us for some time to come. Impossible to second guess what that might look like. Seasonality will become a factor. Spring is coming with some more time outdoors. That's less risky for transmission. So I sense there'll be some easing of restrictions. I hope there'll be some easing of restrictions as we get into spring. It's uncertain how the B117 and or other variants, should they get to Sheffield, will play out. I think it's unlikely government will release all measures quickly. My sense is it will be eased off gently with continual check back. What's the impact of easing restriction A, B or C? I think that will be late spring. Hope I'm wrong there. I would expect summer coming to be a bit like last summer. I suspect there'll be a fairly low rate of circulating virus, but nowhere near as low as it was last summer. I expect that those who are fully vaccinated, which would be a significant proportion of the population by then, may be enabled to do different things. It's possible that there'll be a surge next autumn into winter. Again, I'm kind of predicting a long way into the future there. But my sense is summer will be something akin to last summer. The end game is quite a long way off. Zero COVID is something that's been in the press, something we all want, I want. Achieving it will be really rather difficult. So we should set the aim, but I think actually achieving zero COVID is going to be really very difficult. Think how hard it has been to eradicate polio, where we've had an effective vaccination for the past 40 years. We still haven't achieved zero polio status. So yes, we want it, but it's going to be really quite difficult. So my sense is that there are three end game criteria. One is that R0 will be well below 1, not hovering just below 1. Community transmission, second indicator, will be something akin to it was last summer, 20 to 30 per 100,000. That may be really rather difficult. And a well-vaccinated population, that will be a reality in the not too distant future. So for all of those reasons, I think we're going to be living with COVID for some considerable time to come. I think we'll need to take care for some considerable time to come. You've heard me say before, say again, the basics will remain the basics. Washing hands, keeping distance, wearing face coverings, ventilation indoors, and limiting social contacts will be with us for quite some time to come. And this section on epidemiology with a slightly gloomy note, but it's important that we're really realistic about what the future may bring. So on vaccination, the news is much better. The hard work of the NHS continues, supported by both the council and by the voluntary and community sector. But well over 90,000 people have been vaccinated with the first dose of a COVID vaccine now. Well, and that's more than 1 in 5 of the population, significantly more than 1 in 5 of the population. A huge effort and credit to the NHS for having done so. So in those groups where we are focusing our energy first, the elderly and frontline health, frontline social care workers, it's the norm to be vaccinated. And the vast majority of the early cohorts, the so-called JCVI cohorts 1 to 4, the vast majority have been vaccinated, and we're well on track to have fully vaccinated that cohort by the middle of February, which is not very far away. Obviously, it's dependent on supply, which is a bit out of the city's control, but it's a huge milestone, and credit to all those that have made that happen, and thank you for if you have been vaccinated, because you are contributing to the norm. It's the norm now, and people are taking that up in great numbers. So 3 vaccines have been approved for use in the UK. So it's thus far in Sheffield, Pfizer and the Oxford AstraZeneca vaccine are being used, and it's likely that the Moderna vaccine will be available in the spring and being used in the spring. And as I say, our ambition remains to have vaccinated the first 4 cohorts, kind of people down to the age of 70, health, social care workers, and extremely clinically vulnerable by the middle of February. So next week, this is happening really quickly. So please remember that vaccine invitations are being sent to eligible people when it's their turn. So don't contact your GP or hospital. Or just turn up. Wait to be contacted. It's important I say a few things about after your vaccination. So people who are vaccinated will definitely have a reduced chance of suffering from COVID-19 disease, becoming severely ill. We don't yet know, signs are encouraging, but we don't yet know whether it stops people from catching and passing on the virus. And obviously you can still pass on the virus on your hands. I expect that vaccination reduces transmission risk, but we just don't have the data yet. So it's important that people follow social distancing and other rules for some time to come. It's really important that we take great care on that. So being vaccinated doesn't mean that the restrictions don't apply to you. They still do. And I know people will be disappointed about that, but it's really important because the current level of infection in the city still causes substantial harm to a significant number of individuals. So that's one reason why we should keep transmission as low as possible. So even if you've been vaccinated, you may be able to transmit it. Secondly, and really importantly, the unmitigated spread of the virus invites further mutations of the virus, and we don't want that to happen. So sadly, it is important, until we're absolutely clear about whether or not the vaccination reduces transmission, the rules still apply. With the science is developing quickly, and we'll keep you updated as soon as the science changes. Scams. We're aware of a number of scams that are happening in Sheffield and other areas. We're aware that some people are being contacted by others pretending to be from the NHS and being asked for bank details to book a vaccination. I've had one of those texts. I deleted it immediately. Vaccinations are free. You will never, ever be asked for your bank details to book a vaccination. So if you get a text or if you get contacted by anybody asking for your bank details to book vaccination, just delete the text immediately, because it is a scam. The other thing to say on vaccinations is most people will be aware of the news over the weekend just gone. The AstraZeneca vaccine would appear to be less effective against the South Africa variant of the virus. The science is still emerging, actually. We don't know the full picture yet. What is clear is that it doesn't mean the vaccine is ineffective, and there has been some misunderstanding and misreporting of that, so it's important to clarify that. The study thus far was a relatively small study, and it suggests that the vaccine provides low to moderate efficacy against mild disease. It's about 60% effective against mild disease. Still a pretty good level of efficacy, actually. The vaccine still works at preventing severe disease. The efficacy is much higher at preventing severe disease. And it's important to say that the vaccine, the Oxford AstraZeneca vaccine, still works against the predominant strains of the virus circulating in this country right now. It may be the case that a booster becomes specifically available to address the South African variant, but the science on that developed hour by hour, day by day. So the important message is, if you're invited for a vaccination, take the vaccination. So COVID is still dangerous. It still does kill people, so it's important that people do get vaccinated. So a mild disease you may have, we genuinely don't know this, may have less protection against mild disease, and that is a may, but even that is a much better outcome than severe disease that requires hospitalisation or worse. The Oxford AstraZeneca vaccine and the data that was made available over the weekend still demonstrates that the AZ vaccine is protective against severe disease. It is one study. It's a fairly small study. It hasn't yet been peer-reviewed, so it's important that we don't put too much weight on it, but it is obviously of concern. But all up, being vaccinated is still a lot safer than being unvaccinated. So I'd encourage everybody, when they're invited for their vaccine, to take their vaccine.